Cervical cancer is a significant health concern for women. We're joined now by OBGYN Dr. Katie M. Smith with OU Health. Dr. Smith, tell us, how is cervical cancer typically detected?
Well, thanks for having me. Most women will have precancer or cancer of the cervix found through a pap smear or HPV test. Sometimes a doctor might see something on the cervix, but most often it's found through those screening tests at the gynecologist or maybe your PCP's office.
Now, Dr. Smith, I know some of the guidelines for screenings have changed, at least in the last decade. We might not be getting those pap smears every year like we used to. Are there other symptoms we need to watch for?
Yes, so in addition to seeing your doctor annually, even if you're not due for your pap smear, women may experience bleeding after menopause, bleeding if they are having, normal periods, bleeding between periods, and then bleeding with intercourse. Those are probably the three most common symptoms that we hear if a patient has cervical cancer that's causing, problems that they can detect.
Yeah, now that the HPV vaccine's been around for a little bit, is that helping with the stats on cervical cancer? Is it working?
Yeah, somewhat. There's a lot of good data around the effectiveness of the HPV vaccine in preventing cervical cancer. The best way for it to become more effective is for more of our population to get vaccinated. But we do see that in a younger population that had access to the vaccine, some of those numbers, at least not climbing in the area of cancer. And that's always good to see.
So what age range do you say is appropriate for getting this vaccine? I mean, if someone's an adult and they haven't been vaccinated, is it too late?
No, adults can get vaccinated up to the age of 45. Typically, we will vaccinate women anywhere between, the ages of 9 and 26. Most of our pediatricians will say, age 11, 12, 13. That's when the American Academy of Pediatrics generally will have our young people vaccinated. And so that's the ideal time. But women who are beyond that age, even if they've had an abnormal pap smear, should ask their doctor about vaccination and if it's something that can benefit them, because certainly there'll be a large number of women who can benefit from that.
Dr. Smith, tell us what the treatment options are if someone is diagnosed with cervical cancer.
Well, certainly the earlier that the cancer is found, the better. And if we can identify cells that are pre-cancer, that's even better, because those could be treated with procedures in the office. Some cancers are small enough that they can be treated surgically with hysterectomy. Really, when we get into those advanced stages of cervical cancer, someone that their cancer has progressed to be larger or moved into other organs, those are more difficult to treat. And those patients will, receive those treatments that you think about with cancer, like chemotherapy and radiation. So early identification is really important. So seeing your doctor, getting your pap smear, getting your HPV test.
Dr. Smith reminding us not to miss that annual visit, even if you are not due for that pap smear. Thank you so much for joining us today.
Thank you. And if you don't have a gynecologist, check us out, ouhealth.com.